Hello, my name is Glenda Trevino. I'm from the Copper Queen Emergency Room Department of Bisbee, Arizona, and today we'll be discussing the use of the Panda Warmer in the emergent delivery of a newborn. Each of our departments has a Panda Warmer. It is kept in the storage closet of each facility of Douglas and Bisbee. In Bisbee, the emergency delivery cart is outside of the storage room. In Bisbee, it is stored inside the storage room. You will first remove this out to your room. You will remove your dust cover from the top. This keeps the machine clean after it's been decontaminated between births. You have three important things that you must plug in. The first two is your lines. This is your medical air line. This is your oxygen line. You need to plug these in so you can use the blender to blend the oxygen level as appropriately when you are resuscitating a newborn. You'll need to locate your oxygen and your air regulators on the wall. You'll just twist and pop each of these off. Okay, keep in mind that you will put green in for oxygen, and then yellow is for your medical air. The machine will continue to alarm until both of them are plugged in. Once they are plugged in, it takes a little bit of force to pull them out once they are locked in. If at any time that alarm goes off after the delivery, you may have a failure in either your oxygen or your medical air, or it has become disconnected from the wall. So please make sure that you have it all plugged in. The final thing is the Panda Warmer does not have a battery. So you will have to plug this in to a red outlet in case of power failure. Toggle switch on top, you're going to turn that on. The front of the machine will start lighting up. It will go into the manual mode of preheat. For manual mode, it comes on at 50%. If you're expecting an immediately delivery, go ahead and put that up to 100% to rapidly heat the warmer and turn on the light so you can see what you're doing. Make sure you have towels out, a blue bulb syringe, a cord clamp, and your thermometer probe. You're going to open up your thermometer probe. Yes, if you can get it open. So the probe is one-time use only. It is disposable, so we will not be cleaning this and reusing it. And as you can see, it is a spaghetti monster to untangle. This is the end of the probe that is going to be taped to the infant's abdomen. You're going to tape it to the right upper quadrant over the liver. This end gets plugged into here. And as you can see, it is now starting to read the temperature in Celsius. And it's picking up the temperature from the radiant heater. You have a little sticker that you will use to tape to the abdomen of the baby. And let's say it's been more than 10 minutes, the warmer is warmed up. Go ahead and just turn it down to about 50%, between 25 to 50%, just so it stays warm, since this is already really hot after about 10 minutes. When you get your delivery of your baby, you will be handed your wet infant. You will make sure you have your protective gear on, but for intents purposes, we are just going to use this as a demonstration model. You're going to start drying and stimulating your baby, making sure the baby starts crying. You want good crying. Once the baby is born, you're going to turn on your AppGuard, and you're going to hit start. Your AppGuard timer is right here. Your AppGuard is, you're going to do a series of certain things to check. You're going to check for infant tone, see if they're crying, if they're making any noise, are they grimacing, what is their heart rate and their respiration. Those are numbered from a scale of 0 to 2. A perfect score on the baby is a 10. Average babies are usually anywhere from 7 to 10. Anything below 7 you're going to want to consider possibly needing for resuscitation. You're going to take and you're going to put the probe on the infant's right upper quadrant over the liver, and you're going to tape that down, and then you're going to sit here and switch this mode to servo. And what servo will do is it's going to read the temperature, and what it's going to do is this is the gold temperature to keep the baby warmed up. The servo is going to read the patient's temperature, and it's going to start adjusting the heat of the Panda Warmer for the patient to get the patient's heat up to 36.5 degrees Celsius. As you can hear, the warmer is going off because the patient's temperature is extremely low. So I'm just going to hit silence right now. It does not let me silence it because the temperature is too low. But if this patient was more closer to the 36 degrees, it will just be adjusting, and this would not be alarming. But since I have a doll, it's kind of hard to make the warmth. Now, while you're dealing with the baby, I'm going to put it on my wrist for right now. So I put it on my wrist so you can actually see the temperature going up. There we go.
Okay.
So as you can see, the alarm is saying patient temp, that the patient's temperature is too cold. And it will alarm if the patient is too high. So as you're working and drying your baby, you're going to remember your neonatal resuscitation protocol. You're going to be making sure you're stimulating your baby. You're going to making sure the baby is crying. If the baby is gasping or has a heart rate less than 100, you're going to do positive pressure ventilations on the baby, where you're going to hook up the ambu bag, which we use is the Neo-T. Since this is a doll, it's not going to really work very well, but to use the Neo-T, you would pull it out. You want to make sure you use the adult one. And it screws into the and you just turn it on. And you give breaths.
There you go.
Yeah, you give breaths by putting your thumb over this blue thing and including it. And you look for chest rise. If for whatever reason the child's heart rate is not going up with giving breaths, they're not pinking up with giving breaths, you will adjust your PEEP. If that still doesn't work, you're going to go to the acronym of Mr. SOPA, which means you adjust your mask on your patient. If that doesn't work while giving a few breaths, you're going to reposition the head, put them into a sniffing position. If that doesn't work, you're going to suction the mouth, then the nose, then open up the mouth, increase the positive pressure or the PEEP. And then if that doesn't work, then you're going to consider an adjunctive airway, which is like your LMA or having that child intubated. So those are things that you will need to worry about in a delivery. Keep in mind that for the first 10 minutes of life, the neonate is not going to have 90 percentile oxygen saturation. It is going to be a percentage. When they are first born, in their first minute of life, their O2 sats are between 60 and 65%. Then they go at 2 minutes to 65 to 70. 3 minutes is 70 to 75. 4 minutes is 75 to 80%. 5 minutes is 80 to 85%. And it's not until after 10 minutes that they may have an oxygen saturation of 85 to 95. We will never expect an infant to have 100% oxygenation when they're first born, because they are adjusting to outside life from in utero. You will also make sure that you are ready to, if need to be, to resuscitate your infant in case something happens. If they have a heart rate less than 100 and they have signs of poor circulation, you will start, and you've done the oxygenation, you put in a tube. You put in a endotracheal tube or an LMA, and that still hasn't done, you're going to start doing your chest compressions, have the doctor get an umbilical cath and start giving your medications per your NRP guidelines. Some of the things that you may have with infants is you may have, when you have a delivery, you may have undiagnosed congenital malformations. They can have a diaphragmatic hernia, which they will at first start doing fine, but rapidly deteriorate. You'll notice that they will have barrel chested. You'll notice that they will have a sunken abdomen. When you go ventilate them, they may not have equal chest rise. If you have an infant that has a diaphragmatic hernia, you will be prepared to be sending this child to a NICU. You'll be needing to put an oral gastric tube to decompress. You might have the doctor assist in intubation. You won't, because of the child's intestines are up in the chest, you're not going to have equal chest rise. You're going to monitor this child's glucose levels, because these children will burn through glucose very quickly. You'll need to supplement their glucose with D10 per weight base, per protocol. You will also need to be documenting your interventions, getting a hold of a neonatal transport helicopter team, which can take a couple of hours to come down to us. So you need to be prepared to be one-on-one on this infant for quite some time. After you're done, once the infant is gone from your care, you will need to make sure that you have your Panda Warmer cleaned by housekeeping. They will have to take everything apart, wipe everything down, throw away the disposable equipment, and make sure you restock your Panda Warmer for the next time for use.